name's Scott Willis. I'm the National President of the Australian Physiotherapy Association. The Physiotherapy College is really looking after the specialisation process, so our career pathway right through from new graduate right through to specialisation. So that career pathway, especially onto specialisation, really looks at ensuring that we can tick off at different aspects or different milestones of a physiotherapist's career right through to that centre of excellence, and that is specialisation. So that's the pinnacle of physiotherapy, and that's where we want to get our physiotherapists to actually start to aspire to. We want to try and ensure that the competencies of our physiotherapists at this specialisation pathway is at the pinnacle and optimal process within the profession. What we really want to try and look at is utilising those services of those specialists in physiotherapy to actually look at the complex patients, the areas that really need some specialised care and a specialised physiotherapist looking after those patients. And I think that's really what the college is all about, is ensuring that the competencies of our physiotherapists is really at the core, so that they have the experience, they have the professionalism, and they have the theoretical background to actually manage and treat these complex conditions that physiotherapists are usually presented with day to day. I think where we really need to go now is have a look at the full scope of practice of all practitioners throughout the healthcare system, and really ensuring that every practitioner is allowed to really treat and manage patients to their full scope of practice. So I think that's where health reform is really heading. The other thing is, I think we really need to look at the process and the journey of the patient right throughout when they need care to when they are discharged. And I think this is where our journey for the patient is really important. We need to track that. And at the moment it is very siloed and very hard to navigate. If you're very poor in health literacy, it's very hard for you to actually navigate where you need to go. So the access points are quite hard to access, but also then when you are in the system, it's very hard to actually go through it. So I think the government again has signalled to start having a look at the patient journey, the scope of practice, and some of the different models of care that we need to do. There's no use just pumping more and more money into our current health system. It's not going to work. It's not going to provide increased outcomes or efficiencies. So what we need to really look for is some different models of care, and that's where I think physiotherapy really value adds to the system. If you have a look at total joint replacement, total knee and total hip replacements, they cost about $25,000 per episode. Where if you have a look at physiotherapy that can actually prevent that from happening, or prevent the surgery from going ahead, that costs about $2,000. Currently, Medicare doesn't fund that. There's just no enabler. There's an actual barrier to actually fund that. So I think there's efficiencies within the systems that these different models of care can actually produce, and it will save money, but also add to safety and quality for the consumer into the long term. In terms of digital health as well, I think the government's really started to put their feelers out there and started to look at health reform in terms of digital health. We can't all talk together. We can't actually have a look and see what has presented, say, to an accident emergency department on a weekend when a physiotherapist the next week sees the patient. So I think if allied health and especially physiotherapy could actually have access points to my health record, we can actually securely communicate between each practitioner. I think there's a lot of efficiencies and a lot of quality and safety that will improve, and that will be better for Medicare, but also for the federal government's health spend as well. If you have a look at the Productivity Commission report, if you have a look at 2050, so look ahead to 2050, health practitioners got to do 4 times as much capacity as what we are doing now. So if we continue to do the same amount of work in the same way, in the same models of care, then we won't be able to do that. So I think this is where AI and innovation will actually come into fore. I think this is where we need to push. We need to push for innovation. We need to look at ways that we can actually access or touch points with the consumer to ensure that the efficiencies are there, that we are able to actually drive innovation, and we are able to increase that productivity to 4 times as much by 2050. And I think this is where AI, digital health, wearables, and even the likes of telehealth is really starting to push not just the physiotherapy profession, but the medical profession. I think the medical profession needs to really start looking at our efficiencies and where we can actually drive that. And I know physiotherapy now are starting to use wearables. We're starting to utilise telehealth. We're starting to use our touch points in different ways that we have in the past, our traditional ways of contacting patients to see how they're feeling post-treatment or in between our sessions. So I think this is where AI is going to be really, really important to actually drive innovation, quality, safety, but also that productivity is the key to getting better healthcare and a more efficient rate. Australia is one of the 11 founding members of World Physiotherapy. And I think we take it very seriously, our relationship with the rest of the world in terms of physiotherapy, but also healthcare. So Australia here really recognises our role within not just our region in the Asia West Pacific, but also globally around the world. We have someone on every subgroup of committee within that World Physiotherapy program. But also we value add to the governance structure within World Physio, but also all the countries associated around it. We understand that not all countries have a wealth of knowledge and also the wealth to actually provide the care, the education and the advocacy, the policy, but also the governance. So we're actually value adding and providing a lot of the countries around our region, especially in the Asia West Pacific, the governance education, so that they've got the ability to actually understand what's required to run an organisation, to actually have a look at their educative systems, as well as their policy and advocacy. So I think that's one area that the Australian Physiotherapy Association is really value adding. The other one is through education. We've got over 800 PD events that are online that are fully accessible to a lot of our neighbours around the Asia West Pacific, but also globally to North America, to the Emirates, and we're just in the process of signing a memorandum of understanding with Hong Kong. And this is going to open up a lot of education that they have not seen in the past. And I think this is a really, really good avenue for the Australian Physiotherapy to go down, to actually value add and actually provide some valuable education systems to our partners and to our neighbours around the world. We've also been very, very lucky to have a Vice President of World Physio coming from the Australian Physiotherapy Association in Melissa Locke, who was a past president of the APA. So I think that really demonstrates where Australia is held in great regard in World Physio because of our systems, because of our governance, because of our education, but also because of our thirst to actually provide some valuable insights and assist our other physiotherapy countries within the world as well.